All right, some advantages to being a clinical social worker in the Air Force. Paid CME, so paid continuing education. You don't have to worry about any overhead costs. You don't have to worry about training new people or hiring them for that matter. You walk into a ready-made clinic with an established patient base. Your licensure is good in all states. So if you got it here in, let's say, Massachusetts, and you got stationed in Las Vegas, it would work just the same there as it does here. We do have the 20-year retirement plan, and there is also small, medium, and large clinical settings.
All right, so some of the advantages to being a social worker in the Air Force continued. We have basically matching salaries as the outside has, comprehensive medical and dental coverage, access to excellent colleague consultations on a daily basis. We also provide 30 days of vacation per year that typically carry over to 60 days. Educated and loyal patient base that will follow your treatment plans, no staffing concerns, payroll headaches, tax issues, logistic problems. And you also have the opportunity to complete any type of research that you're interested in doing.
All right. Training as an Air Force clinical social worker. So as an Air Force clinical social worker, you'll be a member of the Biomedical Sciences Corps. You'll also be a highly respected member of one of the world's premier healthcare teams. You enter active duty and attend an 8-week COT training course at Maxwell in Alabama. The course is aligned in a 4-phase approach, which is orientation, development, application, and transition.
All right, so some of the benefits to becoming a social worker in the Air Force, we have that excellent starting salary with regular pay raises and promotions, 30 days of vacation that's paid for each year, continuing education opportunities, tax-free housing and food allowances, comprehensive medical and dental care, and opportunities to live, work, and travel worldwide, and the generous retirement program.
All right, so if this is something that you decide you want to do, the steps that's required to join the Air Force, you'd have to complete an initial appointment with either myself or Sergeant Arnold. We would be asking for your source docs, such as your driver's license, Social Security card, birth certificate, passport, any license and certifications that you have. At that point, we would transfer you over to our pre-processing team, which would essentially help you build your application and get you scheduled for your medical physical at the Military Entrance Processing Station, otherwise known as the MEPS. Once they have that package built, you'd be transferred over to post-processing, who would help you out if you're selected. They would do your OPM or your security clearance, get your commissioning documents squared away, all that stuff, and set you up for success once you go down to OTS. So that was our quick spiel on all of this. So I'm a big proponent of hearing it from the horse's mouth, per se. So Lieutenant Bailey or Mackie, if you guys could chime in and kind of give us your perspective on being a CSW in the Air Force, that'd be highly appreciated.
Hi, this is Lieutenant Mackie. I can say from my perspective, so I was a civilian social worker for about 5 years before I commissioned. And so I felt pretty comfortable in social work, and I will say the Air Force is, obviously the foundational skills are the same, but completely different in terms of how we treat our patients and what patient care looks like. And so it's been an incredible year of learning, but I can say that year of residency is definitely invaluable. We get an opportunity to ask all the questions and not be the expert quite yet. And so typically the residents were put into the bigger clinics. So I'm currently at Wright-Patterson, which is in Ohio. And I've had the opportunity to rotate through many different elements. you're going to make mistakes, you're going to learn a lot, and that's the expectation. So I can't truly recommend in terms of being internship wise. I think it's been one of the biggest growing years for me professionally. And I'm also happy to answer any questions that anybody has.
Does anybody have any questions?
Hi there. My name's Amanda. I'm a clinical social worker in Connecticut. And so I'm wondering, is this solely for active duty? Is there the opportunity for also like reserves?
So what we do is active duty recruiting. If you're interested in the reserves or the guard, you'd have to reach out to them individually. Just do a search for Air Force Reserves or Guard Recruiter, something will pop up. But if you want any questions answered specifically about what a CSW does in the Air Force, now is the time to ask it, for sure.
Absolutely. So what does, in terms of like traveling and, you know, are you guys all, it sounds like all throughout the United States, obviously, but like, are you stationed, you know, say I live in Connecticut, could I, you know, find an area to start just in Connecticut?
So I can speak to that a little bit. This is Lieutenant Bailey. So just to kind of answer your question, because obviously we are active duty. It's kind of going off of that, Amanda. I have a friend that commissioned into. She did find a position in Connecticut, but Blue Air Force, where there's for active duty, which the recruiters we're talking to today obviously do that. But the guard, it's a lot smaller numbers. So you interview actually with the unit. So, right, so you get with your recruiter, you know, maybe there is a vacancy, then I think she's just like 30 minutes away from her unit and she's able to work her full-time civilian job, but it's kind of the same process we went through. You know, she is going to have to go to OTS. It is taking a little bit longer, where with active duty, it's kind of like, you know, this is the time you have to be ready for residency and spun up. You know, this is when you're going to go to officer training. This is when you have to report to your new location, where it's kind of like, I hate to say that, but kind of on their terms, where it's been about a year process for her and she just got approved for everything. So she should be going to officer training. So that training they were talking about this summer, and then she'll do her 1 weekend a month, 2 weeks a year. And there is also that deployability. So she obviously could be up for deployment as well. So just something to keep in mind, but because they are spinning up a new program and she's actually going to be overseeing it for that unit. So a little bit different from us, where we're a lot more structured in the clinic, you know, and they're going to slot us for a job. I think there's a lot more kind of availability, if that makes sense, for growth per se, if you feel like, you know, it's kind of the route that you want to go and not be just in a clinic and kind of oversee. But we also have that option as well, you know, where we're going to be put in leadership roles and not just be a, you know, clinic or staff social worker all the time.
Awesome. Thank you.
You're welcome.
And I didn't know if there was questions in terms of sort of this type of jobs that we do, active duty. I remember that was one of my biggest questions, is what exactly am I going to be doing? And I think the really cool part about active duty social work is that you get the opportunity to sort of get your hands in a little bit of everything. So as an officer, we're anticipated to PCS about every 3 years. So you will be moving often, but with that change comes the opportunity to work in different, what we call elements. So we have our family advocacy program, which is working a lot with families, couples, kids. You do anything from, you know, child abuse, domestic violence to couples counseling. You have the opportunity to work in our drug and alcohol program, which is called ADAPT. During residency, you'll get an opportunity to be a provider, really learn how to work within substance use. And then after that, you'll have the opportunity to actually run that program as a program manager. And then thirdly, you have working as the mental health OIC or officer in charge, which would put you in charge of the whole mental health element. So obviously you'd be seeing patients one-on-one as you would at any outpatient clinic, and then also being in charge of sort of the administrative stuff that comes with that in terms of access to care, the multitude of things that could come up. So there's an opportunity to really, truly learn a lot. And I promise you, you will never get bored, because just when you really master something will change, or you'll PCS and you'll get an opportunity to work in something different.
And kind of going off of what Lieutenant Mackey said too, we're actually at Patterson together, is they're actually embedding social workers into units. They just started that. So, maybe if you're kind of not wanting to do the clinic setting, kind of what she was saying, there's a lot of different opportunities, where you might be with say like a security forces unit, so the police officers of the base, and to help with access of care instead of them calling the mental health clinic and making an appointment. You're there during certain hours, you might be there full time for rotation. And that's going to help, with combat readiness, mission readiness as well. So kind of a different perspective, you're going to learn a lot of different things about the Air Force, and instead of just sitting in the hospital. And there's a lot of outreach opportunities too. We haven't had as many this year just with being residents and rotating, but you could definitely get to see the Big Blue Air Force and do a lot of different things like she was saying in the air, within the Air Force as a social worker.
Awesome. Thanks for that input. So I did have a couple questions that I normally get from people that are interested, that are in the field. One of them is how often would you deploy as a social worker, and where would you actually deploy to?
So I think, as with a lot of questions, it depends. In terms of deployability, I know they typically try to task from the big clinics within the Air Force. Some of the mental health clinics are very, very small. For example, the base I'm PCSing to this summer, I will be only one of 3 providers. And so they can't really afford to lose a provider. So typically your bigger clinics will deploy. I have heard, obviously I haven't deployed yet. I have heard that we don't deploy often, just because it's a pretty small pool of social workers. And we do share deployments with our clinical psychology counterparts. So there are, I think, 3 people in our clinic that have deployed. But again, Patterson's large. And so this pool gets pulled from more often. Deployment locations, they have seemed to vary from the people in our clinic, typically the Middle East, but they're not combat locations. And typically what deployments look like for them is you deploy with one of our mental health technicians, which is an enlisted personnel. And basically between the 2 of you, you guys run your own mental health clinic. So it's definitely a smaller, obviously a smaller setting. You'll see patients on a more regular basis and in a different way in a deployed setting. And sometimes you have to make the hard choices of whether or not sending someone home from deployment. But that is definitely something that's on our radar, and definitely awesome opportunities for us to get to experience as social workers.
And kind of going off of what Lieutenant Mackey says, obviously I haven't deployed either, but it was cool just kind of learning about from the people that did deploy in our clinics, where they do have that opportunity. You're kind of for whole base area, post, so you have that opportunity to set up and what that looks like, right? So they were talking about a lot of outreach they did, or morale things, or just trying to pretty much just set up a clinic from the ground up. And the pictures they were showing us was in a tent, you have your mental health area, and then the other component, you might have physical therapy, and you have a lot of less resources. And I think that, I think you grow a lot as a clinician from what we were hearing on deployment as well. And she kind of said it just depends on the needs of the Air Force, as well as If you're at a bigger base, you probably are going to deploy more with Wright-Patterson, whereas if you're at a smaller facility, probably not see deployment for a while in your career. And then lastly, you do have to be licensed as well. So right now, I'm an LMSW, so I'll finish my license in October. So in theory, then I could be like up for deployment, or we have like cycles where I could go through a deployment at that point. But as of now, one, we can't deploy with being resident, and then number two, just having our limited license still, we also can't deploy.
Okay, yeah, that makes total sense. Cool. Thanks for that input.
So what does a typical day look like for a CSW in the Air Force? Like duty hours, responsibilities, like what do you do all day?
As far as duty hours, for our clinic, we're 07:30 to 16:30. So kind of depends, as a resident, depends on which element you're in. But no matter what, you're going to carry a caseload of patients that you see one-to-one. Really depends on what the caseload is. Our clinic is very, very, very busy. And so like when I was in mental health, carried a caseload between 30 and 40 patients. So the majority of my time was spent in session. And then, as all social workers can sympathize, when you're not in session, you're documenting. So lots of time spent on that. There's also kind of additional meetings and protocols and things when we're working with active duty personnel. So it's not uncommon to have meetings with people's commanders, lots of phone calls to your patients or coordinating things for your patients. We do things like deployment clearances. So we go through people's medical records, make sure that they're A-OK to deploy. It seems like every day we're doing something. As a resident, I will say we have a lot of amazing opportunities for training too. I can't even imagine the thousands of dollars that we've gotten in training. I am so ahead on my CEUs for my license for like the next 5 years. We just went through EMDR training. I mean, we've had so many hundreds of hours of training. So if you're not doing clinical work, you're doing clinical work in a training setting. So that's been really, really cool to bolster your clinical knowledge, to be able to participate in those. So that's usually what my day looks like. I don't know. What about you, Lieutenant Bailey?
I was going to joke, like I'm right down the hallway, so it looks pretty similar. I think, yeah, when we were in the mental health rotation, it was about, I can't remember how many patients, but 30 to 40. So, sometimes we're seeing 8 patients a day, but right now, just with access to care, it's not great. Just with a lot of people PCSing, we're pretty busy. So right now I'm in the FAP rotation, so it's family advocacy. So that's for like any domestic violence, any child abuse or anything like that for the base. So I would say, I think I have a caseload of 20 patients right now, and we just don't have that. So like she was saying, usually get here, 7:30, we might have a morning meeting, and then we get off at 4:30. So right now I'm seeing about, I would say like 4 to 6 patients a day. And then obviously I have FAP, so that's like marriage counseling. So I might have like a marriage counseling session as well. Meetings that come with the different elements. So we have that were rotated through in the residency. So elements being kind of different clinics or subspecialties as well. And like she was saying, there's been a lot of trainings for sure. Like I wasn't EMDR trained, so that was neat to get EMDR trained. We did like prolonged exposure therapy, CBTSI, so for cognitive behavioral therapy for like suicide prevention. I feel like you name it, there's been a training this year for it. And just a lot of meetings as well. So it's been cool. So on Tuesdays we have like guest speakers and different educational, not CU specifically, but different things that we'll have. Kind of day to day, just like she said, it just depends. There's different nuances obviously that occur if we have a patient in crisis. Wright-Patterson, not every base does have this. Just to touch on that, we do have a on-call, so the hospital, so it's not an inpatient facility, but obviously if a patient was suicidal or is in crisis, we do have an on-call phone that we rotate, which that hasn't been too bad. It's been about, say, like every 3 months you might have a weekend on call, then you have like an attending provider obviously to hold your kind of hand through it and just make sure everything's okay. Or you might be on day call where you're holding the phone, because we do have walk-in hours for the clinic as well from 7:30 to 4:30, if a member does feel like they need additional support. But yeah, definitely rotates for sure. I came from community mental health, and I think that became very redundant, squishing in as many patients as you can. So definitely a lot of change up each day. There's some days you do have to stay late, but other days when you're like, I'm done, I'm going to do physical activity time. So you get 3 hours a week of that. So, leave at 3:30. So I think there's definitely some flexibility for sure.
So one common theme that I usually hear from BSc applicants is that the caseload that they have in the civilian sector is usually a lot higher than what they have in the Air Force because it's based more off of numbers than it is off of actual patient care. Does that reign true for the Air Force as well? How does it compare to the civilian sector, in your opinion?
Yeah, I would say that is true. With the exception of residency, they do have us carry a higher caseload during residency just to really, really, really get your feet wet and really get you oriented with the multitude of situations that could happen. But after residency, the expectation is you to take on a more leadership role. So you'll still be doing patient care, absolutely, but you'll be more running the programs. So it'd be more administrative stuff, more leadership stuff, making sure your programs are running well. So definitely your patient caseload goes down to afford you the time to be able to do those things.
We do have a question in the chat.
I think
Hannah. It asks if there are any intern opportunities, and if so, how long do they typically go for?
So guess when you're saying intern opportunities, Hannah, are you talking about like within the Air Force, like after if you wanted to do other things other than just being a social worker, like your residency year?
So I meant more like, so I'm still a student. I'm doing my MSW right now. So I was thinking maybe because we have to do an internship part of our program anyways. So I was gonna ask if maybe I could do one, I don't know, something to do with like social work in the Air Force, if you knew anything about that.
So from my understanding, they don't have, and correct me if I'm wrong, Lieutenant Mackey, like an internship. So they used to have, it's called like a healthcare profession scholarship program where they pay for school. And they did away with that, unfortunately. But I know for me, I did an internship at the VA, which I feel like helped a lot. And I know some clinics and there might be other bases, so I might be eating my words, where you're working as a civilian, able to do an internship. But I know for Wright-Patterson, at least, you can't do an internship here. But I had the opportunity, like I said, kind of, it was different, but working with veterans at the VA, and I did that my senior year internship. And I feel like that helped me a lot, just kind of getting familiarized with the military population. Hopefully that answers your question.
Yeah, thank you.
All right. Well, one of the last questions that I have that normally comes from the field is, do you guys have any type of humanitarian missions that you've ever been on or ever heard of anybody going on as a clinical social worker?
I haven't heard of any specific humanitarian missions. I think the closest thing that we have, well, we do have TDY, so temporary kind of assignments. Most of those are for training opportunities, but we do at every base have what's called disaster mental health, which I would say is probably the closest we have to humanitarian. So anytime there is a crisis that happens within the military installation, DMH or disaster mental health is activated, and we serve as the mental health professionals for that. So, things like suicides, major accidents, a multitude of things that you could think about were activated, and we go out in the field and just respond to those and act as a helping agency. But those are all local.
I would say kind of what Lieutenant Mackey said, that's all true. There's no really like humanitarian trip. I know I've heard of people being activated like in the Guard, but it's still like maybe stateside, where they are kind of doing hands-on all deck, like where they're working in that component of a social worker. capacity. I had a friend that happened to, but other than that, I haven't heard. But the cool thing is with the TDYs, so those are like a temporary like training you can go to. There was, when I started the process for me, I actually had a social worker I was reached out to and was talking to. So she was here for a training. She's stationed in Alaska, but she came here for a training for a week because she's going to be embedded in the units, helping with mission readiness, you know, like I kind of touched on before, helping, you know, access to care. You know, if someone, Joe down the street is having issues with his coworker, he can just come instead of coming to the hospital for an appointment. So that's kind of neat where, you know, you're not just stuck in one vicinity. Instead of PCSing every 3 years, there's educational opportunities. And with COVID, it kind of squashed it for us, but you're able to go outside and, you know, do different trainings and have like, you know, where it's all paid for, place to stay is paid for, obviously gas and like food and everything like that. So it's kind of a neat opportunity Air Force does.
Awesome, thanks.
You guys have any other questions for him? Feel free to unmute your mic and ask. All right, well, if that's it, then I guess we'll go ahead and end the meeting. Thanks, LTs. We appreciate you showing up and answering questions and talking about your experiences. It is very, very much appreciated.
Absolutely. Thank you for the opportunity.
Yeah.
All right, that'll conclude the meeting. Thanks, guys.
Thank you.